What is urinary incontinence? Urinary incontinence is any involuntary or uncontrollable leakage of urine. It can range from a small dribble to a flow of urine. It commonly happens with increasing age, but can also occur among younger people. Urinary incontinence may cause distress, embarrassment, and hygiene problems. It may also affect quality of life, for example, visiting the toilet frequently for fear of leakage or wearing pads due to urinary leakage. Unfortunately, many women go without treatment because they feel uncomfortable discussing incontinence with their doctors. It is important to seek medical advice, especially when incontinence affects your quality of life. Understanding how your brain, pelvic floor, and bladder works. Our kidneys produce 1 to 2 milliliters of urine per minute, which then reaches the bladder through 2 small tubes called ureters. The bladder wall stretches as the bladder fills up to accommodate urine. Urine is kept inside the bladder by a valve-like mechanism of the urethra or urine pipe that remains closed until you have the urge to empty your bladder. When the time and place is suitable, your brain would send messages to your pelvic floor and bladder. The pelvic floor and urethra would relax, followed by the contraction of your bladder to enable you to pass urine. The pelvic floor muscles supporting the bladder and urethra contracts during coughing, sneezing, and exercising to prevent leakage. We would normally empty the bladder about 7 times per day and once at night. Types of urinary incontinence. There are different types of urinary incontinence depending on how and when the patient leaks urine. The most common type is stress urinary incontinence, SUI, which is the involuntary leaking of urine during sneezing, coughing, laughing, lifting, or exercising. Some may need to wear sanitary pads and change their lifestyle due to urine leakage. In Singapore, about 15% of women suffer from stress urinary incontinence. It is caused either by the weakening of the pelvic floor support, from childbirth, menopause, or the intrinsic loss of normal urethral function. In addition, conditions like obesity, chronic cough, and constipation increase the intra-abdominal pressure and may further worsen the problem of incontinence. Another type is urge urinary incontinence, or overactive bladder, OAB, which affects women of all ages and is not simply a result of aging. For example, a patient may experience urgency, a sudden and intense need to pass urine even when her bladder is not full, or increase in urinary frequency. Patients with urge urinary incontinence may complain of urine leakage when they are unable to reach the toilet on time. The bladder muscle contracts inappropriately to empty the bladder. These symptoms can be caused by urinary tract infections, bladder stones, nervous system, or dietary factors such as overconsumption of fluids, especially of drinks like coffee, tea, alcohol. Some people have a combination of stress and urge incontinence. Talking to doctors. Talking about incontinence issues with a doctor may be uncomfortable, but it is important to do so. This is because untreated urinary incontinence may lead to health problems, for example, infections, skin rashes, sexual dysfunction, or psychological aspects like stress, depression, or low self-esteem. These problems can affect work and social life and lead to antisocial behavior. Consider consulting a gynecologist, a urogynecologist who is a gynecologist with further training in common bladder disorders and pelvic floor dysfunction, or a urologist, a surgeon trained in managing bladder and kidney disorders. What to expect during the first consultation? The doctor will take a detailed medical history to understand what type of urinary incontinence the patient has, its impact on her daily life, and also any other medical or surgical condition she may have, including medications she is on. The doctor will then perform an abdominal and gynecological examination to detect any abdominal pelvic mass. In addition, the doctor needs to test how well the pelvic floor muscles work. The patient will be asked to cough with a full bladder to elicit any urinary leakage. A urinalysis may be ordered to test the urine sample for infection or blood in the urine. A bladder scan or insertion of a small catheter after the patient empties her bladder may also be performed to check residual urine. What is a urodynamic study? The urodynamic test is performed if patient does not respond satisfactorily to the following treatments. 1. At least 2 types of medications over 6 months for overactive bladder. 2. After doing pelvic floor exercises for 3 to 6 months for stress urinary incontinence. 3. If you have a combination of both of the above. And or 4. Previous surgery for SUI which has failed. It is an invasive test to measure the bladder's ability to store and pass urine. The urodynamic test can detect whether the patient's bladder is able to empty with an acceptable residual urine of less than 50 milliliters, whether it contracts abnormally during bladder filling, resulting in the sensation of urinary urgency with or without urinary leakage. It can also determine whether patients leak urine when they are standing and coughing at maximum bladder capacity. Finally, it will determine how well the patient is able to empty her bladder. The procedure does not require fasting and takes approximately 30 minutes. No anesthetic is required. It does carry a small risk of urinary infection. Therefore, patients should drink more fluids for a day or 2 after this test. They should also seek medical attention if they develop fever, painful urination, increased urinary frequency, or incomplete voiding sensation after the test. Treatment options for urinary incontinence. There are many ways of treating urinary incontinence. Treatment depends on the type of incontinence and their causes. No single solution to incontinence works for everyone, and it is common to try different options to find out which works best for you. Treatment for stress urinary incontinence. The doctor may recommend conservative treatment as initial treatment, which includes lifestyle changes, for example, weight reduction, avoiding constipation, and cutting down or quitting smoking. Pelvic floor or Kegel exercises can be an effective way to improve symptoms of stress urinary incontinence. The benefits of Kegel exercises are maximized if conducted regularly over at least 3 to 6 months. Up to 50 to 75% of women show an improvement in urine leakage after pelvic floor or Kegel exercises. Patients may be referred to a therapist who specializes in teaching these exercises to guide them along. If symptoms are not improved with lifestyle changes and regular pelvic floor exercises, the doctor will discuss surgical options. Surgery aims to correct the weakness in the bladder, neck, and urethra support. The first type of surgery is a mid-urethral tape, a procedure to insert a permanent sling through a small incision in the vagina. It lies under the middle section of the urethra to support the urethra when you cough, sneeze, or exercise. It is relatively less painful and can be performed as a day surgery or requires a one-day hospitalization. About 80 to 90% of women are cured or experience improvement in their stress incontinence symptoms following surgery. However, it carries a small risk of urinary retention after the operation for about 1 in 20 women. If this happens, then it requires another week of urinary catheter use. Also, your doctor will discuss the risk of mesh exposure, which can sometimes occur in less than 2% of cases. Another type of surgery is Birch colposuspension, which can be performed either as an 8 to 10 centimeter lower abdominal incision or a keyhole approach. It involves the passage of 2 to 3 permanent sutures to the vaginal tissue underlying the bladder neck on each side to a ligament on the side of the pelvic bone to support the bladder neck and urethra to restore continence. Treatment for urge urinary incontinence. Now let's move on to the treatments for urge incontinence. Lifestyle modification is the first line of treatment as it can significantly improve symptoms. Patients should drink about 1.5 liters or 6 to 8 glasses of water each day. You should not consume more than 2 liters of fluid per day unless you exercise regularly. When fluids intake is reduced, urine becomes concentrated and may irritate the bladder. Avoid or reduce intake of caffeinated drinks such as tea, coffee, high-energy drinks, cola and cocoa, as caffeine may irritate the bladder and increase urinary frequency and urgency. Other potential irritants to the bladder include fizzy drinks, grapefruit juice, and alcohol. Try drinking water, squash, or decaffeinated drinks instead. You may consider keeping a bladder diary. It is a simple chart to record types and amounts of fluids intake, urination frequency, and amounts of urine passed. In addition, it can document any urgency or accidental urine leakages. This would provide information on how your bladder is behaving. The chart should be completed over 3 days, not necessarily consecutive, before your clinic appointment. You would be advised to do bladder retraining, a process where you retrain your bladder to hold more urine by gradually increasing the interval of urination. By doing this exercise, you should only go to the toilet when necessary every 2 to 3 hours. If symptoms are not improved with lifestyle changes and bladder training, the doctor would consider medication to help with your overactive bladder symptoms. The medications, including antimuscarinics or anticholinergics, are designed to relax the bladder muscle and stop bladder contractions so you can hold your urine longer and reduce frequent toilet visiting. Unfortunately, it causes side effects such as dry mouth, dry eyes, and constipation. Sometimes the symptoms may improve after a few months of treatment, enabling you to gradually reduce or stop the medication. A small number of patients may continue to have symptoms despite lifestyle modification, bladder retraining, and medication. These patients can be offered either botulinum or Botox injection or nerve stimulation. Botulinum can be injected into the bladder via a cystoscope under local or general anesthesia and cause bladder muscle relaxation to improve the symptoms. The effect can last 6 to 9 months, and a repeat treatment may be required. There is a 5% risk of incomplete emptying of the bladder afterwards, which may require self-catheterization. Your doctor can provide you with more information about this. Another treatment is nerve stimulation or neuromodulation, which is the stimulation of the sacral or tibial nerves to retrain the nerve that controls the bladder. This is only offered to patients with severe and persistent symptoms who have failed to improve with other treatments. In conclusion, urinary incontinence can be cured or improved. Please do not suffer in silence. See your doctor early for assessment and treatment. Thank you for watching this video. This video is presented by Yonglu Lin School of Medicine's Department of Obstetrics and Gynecology. For more videos like this, head on to the National University of Singapore's website.